So how about the cockroach / bedbug group?
Hey, Matt, why don't we tag team this one?
Yeah, of course.
We both took notes. I'm not sure we got to the point of where do we go from here, but there's some really interesting revelations that came out in our session. So, one of the first points that came out in our session was the problematic wheelchair. So when you talk about community-based pest issues, wheelchairs are a vehicle, they're a bus, they're a transportation for both cockroaches and bedbugs into schools. And it's one of those difficult things to treat. I dealt with a wheelchair company, and they were repairing them, but they were not treating them for pests because they didn't know how, and it wasn't their problem. And they were also getting bedbugs in their office. So I don't know why. But of course, anything a child brings in, backpacks, but one of the school facilities staff here said the bedbug dog sniffing backpacks was a very effective tool for them to isolate and mitigate bedbugs, so that they had that happen a few times a year, and it helped reduce the number of bedbug incidents in school. We talked about inspecting incoming goods, which is an obvious thing for cockroaches, because not only can cockroaches like Germans come in from home, but they are much more likely to come in on dry goods from warehouses and from suppliers. So, it's always been a universal recommendation to have the workers inspect boxes before they're brought into the school, and to have a monitoring program wherever those boxes are dropped off, especially. Matt, do you have anything to add? To add?
Sure. So in terms of our interventions, one of the things that we were talking about is the challenge of collaboration. And we did identify some collaborators and partners that would be ideal for interventions and sort of breaking that transition of moving pests from the home to the school or from the school to the home. And it seems like the BOCES health and safety officers are a good group that can sort of be a third party as inspectors of the kitchens in a school and other parts of the building, and have more leverage than others in that position. So they may be able to work within the system to get collaboration with the teachers and the principal and others on staff. So I think we were aware that health and safety officers are a good contact for us, but I think knowing that there's a little more leverage there is also really important.
And just to sort of combine some ideas that are new, some new phenomena, I guess, that happened as a result of COVID, is that we're going to have more food in the classroom, and not just from students, but also teachers. Are food in the classroom. They're going to be spending probably more time in their classrooms, and so when asked, well, does that free up the cafeterias? In many cases, there may be daycare in those cafeterias, so it doesn't free up the cleaning of cafeterias. It makes for extra work. So because COVID requires the cleaning of classrooms and everything else much more deeply, we may be able to get better control of pests, even though there is food in the classroom, but it's going to require probably just a lot more work. And then our friend Tom Jordan mentioned that he's never seen so many Uber Eats deliveries happening to high schools, that not only are the kids eating in the classroom, but the food is coming from delis and local restaurants where you could have pest transfer, but you've also got food waste in every single classroom, including the band room and the gym and all that. So it provides much more of a challenge. I think if I were to say anything about where we should go, I think all of these add up to, we could really use some the IPM coordinator training. I've said it for years, but I think that right now is a great time to look at doing some IPM coordinator training to include BOCES health and safety officers, but as well designating someone in a school district or in a building to be that IPM coordinator and to, you know, get them all up to speed. I think now is the time that we could really do that.
Mhm.
I'll stop there.
The one thing that I'll add to that is sort of the other side of it. So outside of the school, we heard that notifying like when there's a louse or lice infestation or issue, that schools have a good system in place of notifying parents, but maybe we can modify that as well as for other pests to be less alarmist and more sort of, here's some action items that you can take at home to prevent your child from bringing home pests, as well as prevent your child from bringing pests into school. So I think we often miss that opportunity to really communicate effectively and, you know, not freak out parents so that they don't know what to do, but give them very specific action items to reduce the spread of these pests. And I think considering the community is the part that we've often been missing. We always think about what can be done in the school, but we need to think about what we can do in the community as well.
Yeah.
Do local health departments concerning input into schools from parents, teachers, homes of cockroaches and bed bugs, do they have a role, or are there legal limitations there?
I think, Lynn, in many cases, the only official inspection of food service, including school kitchens, comes from the health department sanitarians. But because there's so few of them these days, even in well-funded departments, I think it's very rare that any particular place gets inspected for, you know, for food sanitation, the official rules and regulations that govern.
Yeah, I guess I'm thinking more of a social work approach with, say, a family of students that has a persistent bed bug problem or things like that.
I know that in my county, they have the health department has a Healthy Homes grant, and they can do some intervention when they get a referral and somebody has bed bugs in the school. They get a referral, and that intervention consists of, well, it used to consist of actually mailing or going to that person's house. I don't think they do that anymore, with bed bug interceptor traps and a mattress encasement and information. So I think it's probably a depends if your health department is set up to do some of those things.
And if it's soft money funded, that of course is an issue.
Yeah, I would think too.
Also in the, go ahead, Matt.
Nope, go ahead.
I was going to say, here in the Capital District, we have a Healthy Neighborhoods program, which might be very similar to Healthy Homes. And I've been really working with them to have more pest management information included in that. They had a situation where a family was consistently bringing in bed bugs, and to the point that they were thinking about not allowing the kids to come to the school, which was illegal. So they were looking for some significant help. And they ended up getting help from Catholic Charities that helped to pay to have the house treated for bed bugs to deal with the issue.
Wow.
Is that going to be able to be happening a lot because it's an expensive proposition from a non-for-profit? I don't know, but there are some options out there that can be pretty unique.
And that brings up actually the point that I wanted to ask is about motivation to address pest issues. So like we're approaching this from the perspective that the parents want to mitigate the pest problem, but there may be situations where the parents don't see it as a problem and don't really care that their kid is bringing cockroaches to school. So how do we get over the sort of mental barrier of this is a pest problem and we need you to manage this without providing the treatment and the payment for that treatment? So I think that's part of the messaging, is why it's important to sort of be a participant in that step.
And that's where social workers can come in handy if you have access to it. the social work.
So we need to expand our collaborations.
Yes.
Lynn, we actually ran into that issue with one of the school districts that we had visited, where there was a family that was bringing in numerous type of pests and they did not care. And I'm trying to remember and failing to what the school ended up doing regarding that.
I think you're never going to get compliance from everyone, right? So having that process at the school itself is really vital. So we know this kid has bed bugs, so that kid goes to the nurse's office, gets their change of clothes, gets a different backpack, have the bins or whatnot. But so important that they have a policy
Right.
because
We need a process, yeah.
So Susanna, you work, in your program with home-based programs. And so I wonder, concerning with Matt's concern, in terms of most homes, most families, if there were practical ways of assistance, if they really wouldn't really go for it, might be more of an embarrassment. But I wonder if it's really just just my gut feeling, a minority of homes that don't care about infestations in their homes compared to those that are just frustrated or don't know what to do.
Yeah.
overall, yeah, I would agree. It is a minority that aren't going to do anything. A lot of intergenerational homes though too. If a kid is living with grandparents and the grandparents don't even realize they have bed bugs. So, it's so complicated. There's so many layers where we can't control what happens at home. We can't, Bobby Corgan always says we can't control the rodent population, but we can keep them out of our buildings. So I think it's a good argument to make. We can't control what goes on outside the buildings, but we can control what goes on inside buildings.
So I don't know if this is appropriate, but as a company, in extreme circumstances, we've donated our services to go to somebody's house and treat. And maybe there could be a concerted effort with other companies to do the same.
Yeah, for a while, Cooper Pest Control organized a holiday time period, giveaway. So each company that would participate would donate pro bono work to the program to someone who needed it. And it was regional, I think, not nationwide, but regional, not just in New Jersey. They're based in New Jersey. And I don't know if they still do. It's a really good thing because there's so many folks out there who have no access to pest control and don't have the money for it. And so they were specifically treating, it was bedbug, Bedbug University. It was that group that was, specifically treating bed bugs.
Does the New York State Pest Management Association have such a encouragement or organization of such pro bono activities as Jacqueline referred to?
I don't think they do. Harriet was supposed to be on here today.
No. Okay.
Let's see her.
Seems like it'd be a great public outreach.
Yeah.
Oh, I just have one quick question. So I'm part of the regional One Health, which does not include New York, but includes New Jersey, Pennsylvania, Maryland, and Delaware. And we're actually putting together a program to develop teaching for health workers. And what I'm hearing about school seems to be kind of similar. When you go to the doctor, you're probably going to be also carrying some of the pests that are. So I'm curious. So we're actually trying to create a curriculum where we're teaching directly the medical doctors about entomology and all these other One Health issues. Is there any kind of interaction between the school IPM and sort of medical facilities?
I think that's a great question. The One Health movement, I don't know how well known it is outside academia on a national scale, but it gets people out of their silos because immunology and nature doesn't care about our silos.
Well, Dina, what about targeting school nurses as part of the medical community?
Yes, actually that, well, we had nurses, but now you got me going on school nurses. That's a very good point.
They are organized. They have organizations countywide, so they're easier to target than just one at a time.
Yeah, we're putting together a proposal to try and obtain funding for, to try to set this up in across New Jersey as sort of a test. But that's a great, thank you, school nurses. Thank you very much.
A last comment or two from the first group before we switch to the priorities group. Okay, Joellen, who's your reporter?
So I volunteered Mary Centrella from PMAP, who graciously accepted.
Yes, and if you want to jump in at any time, Joelle, let me know because you're the one that took notes too. So we had a really great group. We had 4 people from New York State IPM. We had a huge group of different people. We had someone from BOCES. We had a lot of people, groundskeepers, technicians for schools. We had an entomologist. We had someone from the EPA who does inspections at schools, a compliance assistant specialist with West Virginia Department of Agriculture. So it was a neat discussion. We were focused on New York State school IPM priorities. And the first thing we asked the group was, what are the foremost school pest issues? The top 3 priorities were rodents, stinging insects, and bed bugs. And we talked a little bit about how stinging insects get into schools, how rodents get into schools. And then we talked about creating a list of school pest issues statewide and prioritizing outreach needs. So some of the top priorities for school IPM was help with scouting and monitoring pests. Education was the main thing. That came up a lot. So education for teachers, education about pesticides and pest control, education of faculty in the community as well, which I think was kind of touched on in the bed bug talk as well. And there was discussion about maybe having pest control classes or more information on pest control. We talked a little about how teachers are, maybe they're busy, maybe they don't know the information very well, maybe they're resistant to change, but how a lot of pest control work is kind of, there's pushback from the teachers, or they don't understand why it's being done. So we talked a little about maybe, contacting teachers that are part of the union, because that can kind of help all other teachers get that information. And we talked about, how to increase education to teachers, maybe doing some more training. We talked about risk benefit analysis of pest control versus, not doing anything, and how to kind of get that point across. And then Lynn Gregory said she'd done a presentation with school administrators and nurses and maintenance staff. So she works with the EPA. She suggested that maybe in-service presentations would be good for the teachers. It seems like we get the ear of admin, but not necessarily the teachers themselves and the staff. So that was an issue we brought up. And we talked a little bit at the end about the health and safety IPM coordinators. So we just talked about needing more representatives on that and getting more involved in that health and safety coordinator. Am I saying that right? I don't know exactly what the title is.
Health and safety committees.
Thank you. Yes, committees. So was there anything I missed there, Joellen?
I think you really nailed it. So typically our audiences have been grounds people and pest control people within the schools themselves. And we've been reaching them through BOCES or through the New York State Turfgrass Association. So we were looking for recommendations on and how do we expand that list out to be able to reach the teachers. And Lynn said that she's been talking to the administrators. I don't think we really had a great success in reaching that group ourselves. So we're looking for feedback. We're looking for help in terms of how to expand our reach so that we can get you guys the help that you need to be able to do your jobs better. And we'll be able to take those needs, say that this is what we heard from our stakeholders, and be able to reach out to other groups and say, hey, this is what was told us needed. What can you do to help?
One thing to look at would be schools tend to have superintendent conference days just before, or like a common days just before they open up for the school year. You might want to look at getting into doing a presentation at those, because then you have the entire staff of each district right there as a captive audience.
So for those of you that work in schools, one of the issues that I've been seeing over the past few years is those health and safety committees or the superintendent days used to look at a greater variety of topics, but it seems that so much of the focus has been on active shooter drills and security issues. So for those of you that are in the schools, are you seeing that that's still the primary focus, or is that starting to ease up a little bit, providing a space for us to get in? What do you think? If you have any comments, just unmute yourself.
I'd say that's still the primary, but you can always bill the IPM as a form of safety. I mean, when you're dealing with bed bugs, cockroaches, mice, and all the just horrific things they all carry with them, that is another level of safety, and safety is really the buzzword right now, and that would be the way I think to get in there. Because let's face it, you're much more likely to encounter a mouse than an active shooter.
What we found that we've done, our district has mandatory day, superintendent's conference day before school starts, and basically it's all staff is there. We do our right to know, our bloodborne pathogens, DASA training. So adding an IPM module into that would probably be a good idea. And then we could get that covered then, and hopefully some of it would stick.
The other one is to do it at the end of the year. Most schools have their HAZCOM day, where you do all of your hazardous communication stuff in one day, and that would fit right in. And we've had our safety coordinators out of our local BOCES. They have done presentations on various things, and I'm sure that's one. In fact, last year, Joellen, I think you were at our school last year for that.
Saratoga, right?
Yeah,
Yes.
when you did the tick drags and all.
That was right after the active shooter guy.
Yep.
Yeah. So one thing in the two surveys, statewide surveys, which I reported on last week, we asked a question on how many school districts have pest management advisory committees, and most don't. As Joellen kind of indicated or alluded to, that could be a function of the Health and Safety Committee, but it's often not. I know at least one IPM coordinator, for those of you who knew Kevin Trotta, he was a IPM coordinator for his school district, and he formed his own committee with representatives from several stakeholders within his school, and essentially provided, everything didn't depend upon the IPM coordinator himself.
I would say Fred Kelvil has done the same thing.
Okay.
So is that a health and safety committee of one, or did he bring?
Oh no, he got together, recruited a teacher, He was with the facility staff member and school nurse, some other key people that he.
It does seem like a really good opportunity. The thing that we heard from a number of people was, teachers are just not on board with this. So health and safety committees can help to get that message out.
Yeah.
We are regulated, but it seems that most schools don't have them, even though they're supposed to.
Joellen, this is Lynn. Can you hear me?
I can.
Okay. I'm headquartered in New Jersey, and in New Jersey, we have an IPM law, school law, which you folks don't in New York, per se, okay? Part of that program involves a yearly educational program that's put out by some of the people in at Rutgers, and anyone can attend. So about 10 times during the school year, there are programs throughout New Jersey in different areas that can be attended by administration, by custodians, anyone who wants to come, basically. It's free. And it lasts for about 4 or 5 hours on once a month, basically. And there is a discussion, a three-pronged discussion. One is about the law itself for new people, new hires who aren't familiar with the law, a section on IPM itself, the principles of IPM, and that is done by a couple of pest control companies who are heavily involved in dealing with schools, and they have a PowerPoint presentation to show various situations in the schools. And then the third part is about turf and athletic grounds, and that's done by a professor at Rutgers. And so that gives everyone sort of a general idea of what is involved in the New Jersey IPM program for all the schools. And so oftentimes when you're talking about health and safety directors, we require an IPM committee that's composed of the school nurse, the head custodian maybe, the IPM coordinator, someone in the science department who might be interested in pests or insects, like the biology teacher, whoever in the school would be interested in IPM itself, and then a few others probably. And they comprise the committee for each school. And then they would be dealing with their physical footprint, during the year, and have monthly meetings and so forth. So very easily that could translate into some sort of a program at that particular school where parents are invited, teachers are invited, and you can go over issues that you might have or want to share with the community groups.
So Lynn, you bring up a good point. So New York State, and Joellen, one of the ground rules for her breakout group on priorities was that as an extension program, we couldn't talk about regulations. But I'm a consultant now, so I will. Well, New York State does not have a school IPM law like some states do. But I think, Lynn, as you and I have discussed in the past, just because a state has a law does not necessarily mean that IPM in schools is improved. It seems like the state must be willing to put money behind educational efforts like Texas does for IPM coordinator meetings, et cetera, and things like that.
Actually, Lynn, I have found that the IPM programs at the schools in New York that I visited are very, very good programs. Many much better than New Jersey.
Yeah, you've told me that before. I was hesitant. I didn't know if you'd want to share that publicly here, but
And I will say that we have done something very similar to that, usually through BOCES.
Mhm. Yes.
Where I always called it the Lynn and Joellen show, and Lynn would also have the regional DEC pesticide person come in to talk about the laws. So if that is something that you have not seen and you are interested in having that in your region, please let your BOCES people know so that they can work with us to put something together. So that was usually 3 or 4 hours. We would cover different topics, and then we would do a mock inspection at whatever location we were.
So there's a couple comments in the chat box. Jessica says, I don't think our school's doing the right to know meeting this year because of COVID, so maybe next year can be incorporated. And Brian says, I find the problem tends to be teachers know things are dirty, but feel it's not their job, it's the custodians.
Yeah, that whose job is it anyway is often problematic.
Yeah.
Well, and speaking as someone whose partner is a teacher, you know, teachers are really busy. I think everyone's job has become that way. You know, it seems like the task load is going way up. There's a lot expected of them. I mean, my partner barely has time to go to the bathroom throughout the day, you know, so I can see where you get this pushback from teachers. Maybe they do see that it's dirty, but they just don't have the time to work on it. And I think if we could work with the school districts to make it a priority, then maybe that would, you know, I think both talking to teachers, but also getting some kind of top-down involvement would help, because otherwise, yeah, how can they prioritize that when they've got so many other things?
So decades ago, there was a project, it was the EPA funded, and it was on to a school district, it was a suburb of Buffalo, on saving energy by cutting unnecessary lighting and electricity use, lights on or off. And facilities staff successfully worked with their teachers to kind of recruit and interact with students. And he said, you know, students, at least for a period, were always turning off lights that didn't have to be on, you know, and they saw they had a distinct savings in their energy bill. And I've often wondered how that might be translated into you know, a collaboration with the facility staff of a school, the teachers of a school, and the students in terms of classroom sanitation.
Lynn, this is Lynn Gregory again. And I think that you really need to work on educating the students, because if you have 2 eyes as a facility coordinator or a custodian, how many students are there and how many eyes are there to actually look around and find problems around the school? I did an air quality study in a elementary school in New Jersey, and they came up with all kinds of situations that they then presented to the principal, who wasn't really too happy that we had done that. But it showed them and that they are very observant. If they see a water leak in the bathroom, they put it down. So the kids can do this too, and it's a good learning experience, probably in a biology class or a science class, to get the kids involved, because everyone needs to be part of IPM in a school. It's not just custodial job that Brian was saying here in that one question. It's a perception, but really everybody needs to participate. Thank you.
Those custodians that have a good rapport with their teachers and students, they are gems. And a few years ago, several in our program, we visited 2 elementary schools in the Albany School District. and interacted with the head custodian or well, custodian in those two different schools. Strikingly different personalities. You know, one, we go down the hall and the students, all of the elementary kids almost hugged the guy. While the other one, all he did was, when we were with him, was complain about the students and teachers. And it was pretty easy to predict which one would be a better partner with us.
We could also see a difference in how the teachers and the students took care of the school.
Yes, yes. Okay, we've reached the end of our 2 half-day conferences, and I think our program has found very helpful things to take home for us, and hopefully you did also. Some reminders, Gemma has posted the post-test in the chat box, so please take that. Certified applicators seeking recertification credits, you need to check out, similar to the way you checked in this morning. And later you will be sent the link to the evaluation. And of course that provides needed feedback for us. And you also need to fill that out if you want your FIT tool. Okay, any other people in the IPM program have any closing words?
They
Gemma?
really want that FIT tool, that's all I want to say.
Yes, right.